Okay, so trying something slightly different here. We're gonna study kind of live and record myself as I study for a history and physical exam, which I have 6 days from now. I have not started studying it at all. I have 8 PowerPoints I have to get through. It's a lot. It's a dense exam. It's all on neurology. So we're gonna walk through this. All right. So what I'm gonna do first, well, so I've been to class for every single session here, and I have Anki flashcards from class. So I kind of have to trust myself that I filtered out what is important, what is not so important. And I have a total of 293 flashcards for this exam. It's not everything. There's certain portions that I need to kind of like go back to, but this should be enough for me to have a really solid, not even foundation, but for me to score fairly well on this exam. And I just have to, focus in on other things. So anyway, what I'm going to do first is actually just scroll through the PowerPoint really quick. I do have it off screen here. So I'm just going to go through. And then we'll go through the flashcards. So the first one is on neuro basics. I have 22 cards. So I just want to see what's in this PowerPoint. I'm not studying. I'm not even really reading everything. I just want to see what are all the things that I'm about to be tested on via the flashcards I made. So we have some basic neuron anatomy. We have central nervous system versus peripheral. We have upper motor neuron versus lower motor neuron. We have gray matter, white matter. We have just like the basic lobes of the brain, some anatomy. We also have what cranial nerves pass through parts of the brainstem, like midbrain, pons, medulla. So we'll see if we can come up with some mnemonics for those. Motor tracks, sensory tracks, pairs of spinal nerves, and then neurological history, some equipment, and I'm done. All right, so that's the PowerPoint. So I know what I'm about to be quizzed on, at least the general content. I've seen it with my eyes once, and let's go right in. So we're going to open up Anki, zoom in a little bit here. I do have my trusty Super Nintendo controller, so we can use this. And the idea here is not to like look up the answer if I don't know it. It's just to brute strength grind through this. So motor tracks, aka blank, a direction tracks. I don't know. So descending. So motor tracks are descending. All right, that makes sense. I'm sending motor information down from the brain. So we'll come back to that. All right, cranial nerve 3 and 4 are housed past through the I don't want to make a guess because I'm not sure. All right, so it's midbrain. So 3 and 4 pass through the midbrain. Okay. The CNS spinal cord, SAD. I don't know what I'm getting at here. Sensory. Okay, so this is the mnemonic. So sensory are the afferent sensory fibers, and this is from the dorsal posterior. Okay. Spinal nerve C1 to C7 pass over blank of the corresponding vertebrae. Over top of, yes. There is or are blank pairs of coccygeal nerves. Aren't there 5? There's just one. Okay. Hunger and thirst are controlled by is this the hypothalamus? Sure is. See, cranial nerves 5, 8 pass through I feel like it just works its way down. So is this the midbrain? Or is that what I just said for the other one? No, it's the pons. So 5 through 8 are the pons. Circadian rhythm and temperature. Sorry, just turning my light on here. Circadian rhythm and temperature are controlled by the Can I just talk about temperature? Is this not hypothalamus? It is. Parietal lobe equals primary sensory cortex. Yeah, okay. Cranial nerves 9 through 12 pass through the medulla. Okay, so 9 through 12 medulla. Peripheral nervous system is actually made up of the spinal nerves, peripheral nerves, and I think cranial nerves. Yeah, not CNS. They're PNS there. Sensory tracts are blank direction. Direction, spinothalamic and posterior columns. Like they go up, ascending. Okay, sure. Through the spinothalamic posterior columns. We have blank vertebrae. Oh, so it's 7 cervical, right? 12 thoracic, so that's 19. 5 lumbar, so that's 24. And then is it counting coccyx is 25? Let me double check. So it's 7 cervical, 12 thoracic, so that's 7, that's 19. 5 lumbar, so that's 24. I think it's 25. 33. Wait a minute. What am I missing here? 33. Does this mean like nerves? 33 vertebrae. What am I missing here? Cervical vertebrae. There's not 8. There's 7 of them. There's 12 thoracic for each of the 12 ribs. So that's 19. Sacral. Oh, and then lumbar is, oh, I think I forgot sacral. Lumbar is 5, so that's 24. Sacral is 5, so that's 29. I don't know. This is like really basic stuff. Why do I not know this? 33. Can I just not count? 7 cervical, yes. 12 thoracic, yes. Oh, there's 4. Okay, that's what I'm missing. So I was missing sacral. There's 5, and then there's 4 coccygeal. I, I did not know that. I thought the coccyx was one thing, not the case. So what I'm going to do is, like, you think you know the basics, but you just don't. But that's what this is all about. It's okay to feel stupid sometimes. So I'm going to add this. I am screen sharing, right? Yeah. Right? Screen sharing. Yes. Okay. So we will come back to that, but 33. All right. All right-handed and half of left-handed people are left hemisphere dominant. 3/4. See, it was half in the other class. That's what's like a little frustrating. All right. I'm gonna give that to myself because I'll remember that. Blank color matters, cell bodies, dendrites. The actual bodies. Is that white matter? It's gray matter. Okay. Temporal lobe equals primary. Temporal. I don't know. Auditory and olfactory. Okay. The thalamus, hypothalamus, and pituitary are part of the. Is this the diencephalon? It is. Good. Okay. Diencephalon, brainstem, cerebellum are in the subblank division of the brain. Subcortical, subcerebral. I don't know. Subcortical. Okay. Breathing, HRBP, vomiting, sneezing are controlled by the, this should be the medulla? Yes. The spinal cord forms the cauda equina after L3-4, L1-2. Okay. There are blank pairs of spinal nerves, including blank pairs of cervical nerves. Is it 33 with 8? Okay, 31. So 2 of them don't have. I'm not going to think about that too much. I should probably know this, but I do know that there were 8 for cervical, but 31 pairs of spinal nerves. Sure. Lower motor neuron. Sorry, still a little sick, I guess. Originate and terminate within the blank nervous system. Include cranial nerves. Originate probably peripheral, which includes cranial nerves and not spinal nerves. Oh, cranial nerves. Yeah, peripheral. Yes. All right. So the CNS spinal cord. So it's sensory is afferent, and these descent. That doesn't make sense. Oh, dorsal posterior. Okay. Um, We'll come back to that. 3 and 4 are housed past through the what? Is this the midbrain? So midbrain. So how am I going to remember 3 and 4 midbrain? I don't know. I think I just have to remember it. Motor tracks are blank direction tracks, cortical spinal column. They are descending. There is blank pairs of coccygeal nerves. Coccygeal. So is it 4? Wait, what? Oh, nerves. Aha. So there's 4 vertebrae, but 1 pair of nerves. Good to know. 1 pair, but 4 vertebrae. That's why we're getting that 31, 33, because that's a difference. That's a difference of 2. Anyway, 5 through 8 pass through the, so it's not the midbrain. There should be the pons. So 5, 8, pons. We have blank vertebrae, 33. So it's 7 cervical, 12 thoracic, 5 lumbar, 5 sacral, and 4 coccygeal. 10, 22, 29, 33. Blank color matter, cell bodies, dendrites. This is gray matter. Okay. I guess the neurons or axons are white. Temporal lobe equals primary auditory and olfactory. So smell and hearing. Okay. There are blank pairs of spinal nerves, including blank pairs of cervical nerves. So 31 with 8 pairs of cervical. Spinal cord forms the cauda equina after L1, L2. Spinal cord. So sensory goes with afferent is the dorsal posterior side. Okay. So I assume for motor, it's just the opposite. Hunger and thirst are controlled by the I'm hungry, I'm thirsty. Did I see this card already? Hunger and thirst. I don't know this. It is hypothalamus. Okay. Circadian rhythm and temperature are controlled by the hypothalamus that has the temperature set point for fevers. Hunger and thirst are controlled by the hypothalamus. It usually doesn't show me a card that quickly after I got it wrong. Parietal lobe equals primary sensory. Spinal nerve C1 to C7 pass over top of the corresponding vertebrae. And then 8 is going to be underneath C7 on top of T1. CNs 9 through 12 pass through these. So 9 to 12 is the only one I haven't done so far. So this is medulla. Yeah, 9 to 12, medulla. Sensory tracts are blank direction. Spinothalamic posterior columns. Sensory tracts aren't these ascending? Yes. So the sense is coming up, the motor's coming down. The PNS is actually made of the spinal nerves, peripheral nerves, and the cranial nerves. I doubt the questions are going to be this basic, but it's like good stuff to know, right? The thalamus, hypothalamus, and pituitary are part of the blank of diencephalon. The thalamus is like that triage center, right? It like processes sensory information. Hypothalamus does a lot. It even controls the pituitary. Diencephalon, brainstem, cerebellum are in the subcortical division. All right-handed and blank of, so 3/4 of left-handed are left hemisphere dominant. Breathing, HRBP, vomiting, sneezing. This is the medulla. Yes. Blank color matter, cell bodies, dendrites. This is gray matter. Motor tracks, aka blank direction tracks. This is descending. The spinal cord forms the cauda equina after L1, L2. CNs 5, 8 pass through pons. 5, 8 pond. I don't know. I'm thinking of like 5, 8 and a pond for some reason. Oh, actually, there's a golf course called 5 Ponds Golf Course and 8. I don't know. There's a par 8 there, or your golf ball is an 8 ball. I think I'll remember that. Nice little mnemonic. I should like to put these in green. Lower motor neuron originate and terminate within the peripheral nervous system, includes cranial nerves and peripheral nerves. Same answer there. Sensory, afferent, dorsal, or ventral. I'm sorry, or posterior. Temporal lobe equals primary, olfactory, and auditory. What I hear and what I smell. Temporal lobe. 3 and 4 are housed passed through the what? So it's not pons, it's not medulla. This is midbrain. So 3 and 4. I'm thinking of like 3 is like in the middle of my hand, and then you just add one more, whatever. Hunger and thirst are controlled by the hypothalamus. There are blank pairs of coccygeal nerves, 1, but 4 vertebrae. There are blank pairs of spinal nerves, including blank pairs of cervical nerves, so 31 and 8. And that's it. So that's PowerPoint 1. Is it every single detail that was on that PowerPoint? No. Is it enough to get me through any question that might be asked? I don't know. We'll see on Tuesday, right? Okay. I'm actually going to go to, I kind of want to do this in order of what we actually do in like the actual physical part of this class. So we're going to go right on to 4, which is the motor exam, because that's what we would do next. So we're going to go ahead, H&P, and we're going to hit motor. This is a 60 PowerPoint slide. I have 49 cards for this. It's probably going to be a little bit more in depth. So again, I'm going to run through these. All right, so the primary motor cortex is in the frontal lobe. We have things called pyramidal and extrapyramidal systems. We have motor tracts. This is like those descending tracts we were talking about. We have things called the corticospinal tract. We have parts of the basal ganglia. Involuntary movements like tremors. We have Parkinson's. We have wing beating. These all have different hertz or oscillation rates. We have physiologic tumors, intention tremors, oral facial dyskinesia. We have tics, vocal tics, chorea, which are jerky asynchronous movements, something called athetoid, which is twisting and writhing like a worm or a snake. Dystonia, fasciculations, fast, involuntary, spontaneous muscle contractions. You can see this in the tongue a lot. Tetany, which is like involuntary painless spasms. What you see with, I think, hypercalcemia? No, hypocalcemia. So it'd be the removal of the thyroid, because you'd get rid of calcitonin. But then if you'd have parathyroid, I won't think too much about that. Exercise. Muscle bulk is in here. Passive range of motion, about halfway through. We have upper motor neuron diseases with spasticity. We have this increase in resistance, cogwheel rigidity, lead pipe rigidity. We have 0 through 5. And then we have like wrist extension. What does that test? C6 through C8. We'll see what cards I have. Then I think this is the one with, there's like 19 tests that we do. There's a lot of tests that we do. I don't think I have cards for this, which is good. I can come back to this. I can triage this. This is one of those things like it would probably take me 2 hours to master to get maybe 2 questions right on the exam. And I feel like in PA school, you have to ask yourself that question a lot. Is it going to be worth putting all that time in, or should I focus on other things? You know, it's like one of those things. All right. That is the gross look at the motor exam. Let's see if I can get through this. It's going to be a lot. All right. Writer's cramp, torticollis, opisthotonus, involuntary contractions of axial muscles leading to bizarre postures. I have no idea. All right. This is just called dystonia. What is opisthotonus? So this is just a definition question. Spasm of the muscles causing backward arching of the head and neck, like in tetanus. Dystonia is just a movement disorder. It's like a muscle contraction. I should probably put that general definition here. So this is like an example of this, and then definition is this. Okay. Oh, this is going to be a long one. Lower motor neuron is, I think it's decreased tone, decreased reflexes. Decreased tone, absent reflexes, we'll see wasting, we'll see fasciculations. I think upper is just like a higher thing. So it's where you get increased tone. So we'll take that, but we have to know fasciculations have are lower motor neuron. Give me one sec. Okay, Huntington's disease and Sydenham's blank causes this rapid jerky movement that disappears with sleep. So this is oh, there's two words. I don't know, tetany, Korea. Okay. All right. Control voluntary skilled movements travel through the corticospinal tract. Voluntary and skilled, corticospinal. Okay. This is something I'm experimenting with this semester. Rather than have me recall the full word, just give me half of the answer. I think as long as I'm recalling part of it, I'll remember all of it. So voluntary skilled movements are going to be corticospinal. Pathway neurons and cerebral cortex. We'll keep this binary. That's all I want to know for now. Active movement against full resistance without fatigue nets a muscle strength. Oh, so it's 0 to 5. 5? Yeah, there we go. That's normal. 5, and we're just going to stress, which is normal. Definitely going to be a question like this on the exam. I know I have multiple of these in the cards. It's good to know what's full. All right. Or like what's normal strength. Lower motor neuron diseases like ALS, spinal nerve injuries, Guillain-Barré can cause muscle like wasting or like atrophy. Bilateral shoulder and proximal arm, so like up towards the shoulder, tremor seen in Wilson's disease. I don't remember the name of this. Okay, a wing beating tremor. So they both start with W. Maybe House was calling Wilson a chicken. So Greg House was calling Wilson a chicken. So you have this wing beating. Most neurons in the cerebral cortex cross over in the, you know what? Is it medulla? It is medulla. So most neurons in cerebral cortex. I don't think it's most neurons. I think it's most neurons in the corticospinal tract. Cross over in the medulla. So I think, in other words, if there's an issue with voluntary skilled movements like raising your arm, then the lesion is going to be on the left side, because if my lesion is here, it's coming down, it's hitting my medulla in my brainstem, and then it's crossing over and affecting weakness in this side. I think that's the idea here. This is a voluntary skilled movement. If there's a weakness, because this is corticospinal, the lesion's going to be the opposite side. I think that's the idea here. An involuntary painless spasm that can be caused by hypoparathyroidism. So this is that, yeah, hypoparathyroid, PTH increases calcium, so hypo. Okay. Is this tetany? This is tetany. Okay. So all low stuff, hypomagnesemia, hyperventilation, blowing off CO2, alkalosis can cause this too. That's pretty interesting. Cool. Blank hypertrophy, increased muscle mass, but diminished strength. Muscle feels like rubber. No idea. Pseudo hypertrophy. That's interesting. How do you test muscle tone? Passive ROM? Let's go, baby. The motor exam muscle strength. No, so 0 is, I don't know, movement, no strength. And 1 is, okay, so 0 is no muscular contraction. 1 is barely detectable contraction. All right, we'll come back to that. It's good to know like the low ones, obviously, too, and then the 5, and then you kind of work it in the middle. All right, the anterior corticospinal tract. So voluntary skilled movement. It's in the anterior of the spinal cord, I assume. Do not cross over at the medulla. Interesting. They cross over at the level of the blank. I don't know. The spinal cord. Limb muscle versus proximal muscle. So proximal muscle is, I don't know, like my chest and my shoulder. Oh yeah, you could see it here. The blue one crosses, which is the lateral. Oh, that's why it said most. But the anterior corticospinal tract, the things in the front. So I think I'm still good to say my limb muscles, like my hands and my arms, but my shoulder, maybe like my trap, which is I would call a proximal muscle, or like my SEM, which is what my spinal accessory nerve, I would call that a proximal muscle. So I would think if I have shoulder weakness, because that anterior corticospinal tract is not crossing over until level of the spinal cord. What level of the spinal cord? Like as soon as medulla ends? I don't really understand what that means. All right, I'm not going to think too much about that. But anterior does not cross over at the medulla. But yeah, the level of the spinal cord, isn't that inches below the medulla? I don't even know if I got that right, but I'll take it. Lower motor neuron lesions seen with polio, Guillain-Barré, ALS cause a blank in muscle tone. A decrease in atrophy. All right, patterns of weakness. Upper motor neuron, increased tone, like hyperreflexes. Cogwheel rigidity, a regular intermittent break in tone. I think this is Parkinson's. And lead pipe rigidity, increased tone throughout the whole range of motion. This is Parkinson's. So cogwheel is regular, but intermittent, like dot, 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 like a cogwheel. And lead pipe, solid, baby. Increased tone through the whole range. I'm going to type that out. Cogwheel is intermittent, like a cogwheel. Lead pipe is increased throughout the whole range of motion. Like a solid lead pipe. And this is all Parkinson's. Good. Duchenne muscular dystrophy causes this type of muscle bulk. Pseudo, maybe? I don't know. It is pseudo hypertrophy. It was a lucky guess. So in terms of muscle strength, most neuropathic weaknesses present with distal weaknesses greater than proximal weaknesses, kind of as you would expect. Okay, sure. Like I can move my shoulder, but I can't lift up my hand. I can't move my fingers. Okay. However, in blank pathic weaknesses, you will see proximal weaknesses over distal weaknesses. An example here is Duchenne muscular dystrophy, where a patient climbs up their own legs to stand up, meaning their foot is strong and ankle are strong, but like their hip is weaker. What could this be called? Pseudoneuropathic? Oh, myopathic. Okay, so it's a muscle weakness versus like a neuro weakness. That's pretty interesting. Upper motor neuron diseases actually blank and muscle resistance increase. So increase spasticity of this rigidity. Yeah. Paralysis, absence of strength. Pardon? Oh, plasia. This is like this is a suffix, is what I'm looking for there, like hemiplegia. Yeah, like a paraplegic. Yeah. Slower, more twisting and writhing than chorea, resembling a worm or snake. Oh, I don't remember. I'll know it if I saw it. Seen in cerebral palsy and basal ganglia disease that disappear with sleep. Is this like the orthopiusis? No, athetoid. Okay. I think I did Google that though. Athetoid. I was thinking of dystonia. Yeah, it's like a type of cerebral palsy. That's probably the big one, cerebral palsy. You'll see athetoid. So a worm or snake. Ath kind of sounds like an asp, which is a snake. Like an asp is a snake, right? Yeah, absolutely is. It's a snake in the Nile region. Sounds like asp, so slow, twisting, snake-like, and just kind of remember cerebral palsy. I don't know, a snake crawling down your face and, with cerebral, I'm thinking of Bell's palsy, never mind. But cerebral palsy. A little mnemonic for that. We'll come back to it. Okay, so now we're at 2 to 3. So I have no idea. So 2 is going to be active movement with gravity eliminated. Gravity eliminated. What are we in a space shuttle? And an active movement against gravity. I don't know what that means. How are we eliminating gravity? I don't know what that means. 3, active movement against gravity. Okay. There are 17 slides. This is a note to, sorry for the language. This is a note to myself to look at 17 slides that I still have to card. So that's the thing I was talking about. Risk versus benefit. Do I want to actually go through that for the couple of questions that'll be asked? I don't know. We'll see if I have time. Whoops. What's happening here? Oh. The primary motor cortex is located in a blank lobe at Brodmann area 4. Primary motor cortex, it's frontal lobe. Brodmann area 4. What is that? Brodmann. I've never heard of that in my life. Brodmann is only mentioned once. Okay, sure. I feel like I should Google that. Brodmann area. It's a system to divide the cerebral cortex according to cytoarchitectural organization. Oh yeah, it looks like there's like 40 of them. 47? Jumping, kicking, grooming behaviors, like combing yourself, echopraxia, which is the imitation of someone else's actions, corpopraxia, which is our obscene gestures, which I think is funny because it's like that's the gesture you would make in like a corporate environment. That's how I remember that. Are known as blank tics and can be seen in Tourette's syndrome. I have no idea. Complex tics. Okay. Yeah, jumping, kicking, they sound pretty complex to me. Blanks test. Tap on facial nerve against bone, anterior to ear, leads to ipsilateral contraction, which means same of facial muscle. I think this is the one that has to do with hypocalcemia. I just don't remember the name. This is called Schwarzdeck's sign. All right. Schwarzdeck's sign. Tap on the facial nerve against the bone anterior to the ear, leads to ipsilateral contraction. All right. Trousseau's occlude the brachial artery for 3 minutes. 3 minutes with a BP cuff leads to carpopedal spasm, which is thumb adduction flexion. I think it's this. It's almost like an Italian. Trousseau, fake Italian. The caudate nucleus, putamen, global pollidius, septima, and substantia. These are parts of the basal ganglia. Up, yeah, I even wrote a note like up to you, bro, if I want to memorize this. Yeah, it's not that bad. This is all brachial plexus stuff. We'll get to it. We'll get to it. The elderly, a dentulous with no teeth, and levodopa, which is a Parkinson's med, can cause which involuntary movement where you might see tongue protrusion, eye blinking, and grimacing? Facial tics? I don't know. Oral facial dyskinesia. Rhythmic, repetitive, bizarre movements of the mouth and lips, often with jaw and tongue protrusion, eye blinking, grimacing. Just being old and having no teeth. That's crazy. I think the guy in Breaking Bad had that. Hector. Paralysis of both legs. Oh, he had a stroke. Is this paraplegia? It is. Hemiplegia is one side. Paraplegia is loss of legs. Paralysis of legs. Which tremor seen in a hertz of 4 to 12 can be improved with alcohol and appears when muscles are involved, yet the patient has no increased muscle tone? No idea. An essential tremor. Okay. So essentially, your muscles are involved, but there's no increased muscle tone. I'll write that out. Apparently, your muscles are involved. I hope they don't ask about the hertz. But no increase in muscle tone. This is 4 to 12. All right. 4, active movement against gravity and partial resistance, and active normal against full resistance and gravity. Oh, without fatigue. Okay. So 4 is active movement against gravity and some resistance, like somebody pushing me and I can resist them and I have gravity. That's a 4. Full resistance without fatigue. So I have like my full weight and you can like lift up probably just like a weight without fatigue. That's a 5. All right. Of the motor system of the brain, abnormalities of the extrapyramidal system cause blank movements. I have no idea. Involuntary. This is where the basal ganglia live. So involuntary makes sense there. The basal ganglia is extrapyramidal. So Parkinson's lives there, Huntington's lives there, Wilson's is there with the wing flapping. Huntington's, I'm not gonna worry about the spelling. Parkinson's, Wilson's are all here. So they are extrapyramidal. The basal gang is very extra. They are so extra. Involuntary. I'm gonna give myself that one. Huntington's disease and Sydenham's blank causes rapid jerky movement. Is this chorea? Yes. Chorea causes this rapid, jerky movement that disappears with sleep. So it's like, I don't know, maybe you're dreaming about the country Korea, and then it disappears in sleep. I'll remember it. Sit in hams. Writer's cramp, torticollis, opisthotonus, involuntary contractions of axial muscles leading to bizarre postures are an example of this. This is dystonia. Okay. Torticollis is that SCM issue, right? Why would that cause? What is opisthotonus again? Oh, let's just like throw that in there. So this opisthotonus, spasm. This is that backward. This is that backward arching. Okay, I did say dystonia though, I think. Bilateral shoulder and proximal arm tremor seen in Wilson's disease. This is it just called wing flapping? Wing beating, same thing. And that's extrapyramidal because it's involuntary. What are these all involuntary? What hurts is a physiological tremor. So transient and not out of range of normal, occurs with fatigue, cold, fright, caffeine stimulation. I don't know, 2, 8. I use so many 8-ball mnemonics for this. Physiologically, we're able to play pool. 8-ball. Okay. Pyramidal versus extrapyramidal. So the pyramidal system, primary motor cortex, cortico blank, corticospinal, and cortico motor. All right, corticospinal, corticobulbar to the lower motor neurons. I don't love this card, but that's going to be voluntary movements. Yeah, because corticospinal, is that what we're saying? It's like those voluntary skilled movements. So I guess that makes sense. I don't know what the corticobulbar tract is. All right. Blank hypertrophy, increased muscle mass, but diminished strength, muscle pseudo hypertrophy. What do we see that in? I don't remember, but that card will come up again. All right. 0 is no strength, no movement, and 1 is like just barely. It's contraction is what I'm looking for. No contraction, barely detectable contraction. Blank tremor. So 5 hertz, so less than physiologic. Wasn't 1 like 4 to 12? Also known as a cerebellar tremor. So that kind of balance area. Tremor intensity increases as blank. All right, so this is called an intention tremor. It increases as patients near object they are searching for. So this. So that's the intention. My intention is to grab it, but I can't, and I'm trying to get it with all 5 of my fingers. So 5 hertz, this is my intention. As I get closer, my 5 fingers start to shake. So that's how I'll remember that. Is with all 5 fingers. So it's 5 hertz and gets worse as we near the object. So, and then this is MS and any like balanced cerebellar things. So we'll try to remember that. Okay. Of the motor system of the brain, the pyramidal system controls blank movements. Well, isn't it extra versus, it's voluntary versus involuntary? It depends because extra is involuntary. So this isn't correct. I forgot to add a part to this. Oh no, this is right. I thought it was like extra versus like intrapyramidal. Pyramidal is voluntary. Extra pyramidal is involuntary. I did know that. I'm gonna give myself that. How do you calculate the hertz of tremors? Oscillations in blank seconds divided by, I think it's not like 6 or 12. It's 10. Oh, there's a 6 in there. So 10 seconds and divide by 6. Okay, a lot of numbers. Weakness, impaired strength. I don't know what the medical term is. Paresis. Okay. Yeah, hemiparesis, hemiplegia. So this again is a suffix. Rapid, purposeless, jerky, asynchronous movements involving various parts of the body. I don't know. Korea. Okay. All right. And we see that with it. And this is what disappears with sleep. A motor exam grade of 0 means 0 muscle contractions. Good. So you can see I typed out questions from that image occlusion just to really build on that. Excessive glucocorticoids, like Cushing's, oh, we learned about this in nephrology, can actually cause the blank of muscles. Excess glucocorticoids. So these aren't like testosterone steroids. I'm gonna say atrophy. Let's go, baby. Do I know why? No idea. But atrophy, steroids, I mean, aren't they like anti-inflammatory, like autoimmune? Sure. Paralysis, absence of strength. Um, Plegia. Corticoblank tract cranial nerves. Bulbar? It is. So corticospinal, which we know are the voluntary movements. Corticobulbar tract. So this is just a tract. So of the cranial nerves that have motor activity, I guess those are going through this corticobulbar tract. Okay. All right. So in terms of muscle strength, most neuropathic weaknesses, okay. Yeah, in myopathic weaknesses, you'll see proximal weaknesses are greater than distal weaknesses, meaning my ankle is stronger than my hip. So I can use my ankle to climb up my hip to actually get up. So you see that in Duchenne's muscular dystrophy. Okay. Visible, fine, fast, involuntary, spontaneous muscle contraction that can often be visualized. Secondary depolarization of load or motor neurons causes contraction of skeletal muscle. Geez. Benign ALS, spinal muscle fasciculations? Okay. Uh, sure. A pill rolling tremor at 4 hertz. Do we remember anything about 4? No, but I think pill rolling is Parkinsonian. It is. And it's usually unilateral. I think that's just like this. So you would count in 10 seconds and divide by 6. So I would do this, what, 24 times in 10 seconds? That's pretty fast. 1, 2, 3. It's like 2, it's like, what, 2.4 a second, right? Whatever. Schwarzschild's test, Schwarzschild. You tap on the facial nerve, you get that ipsilateral contraction of the facial muscle. This is hypocalcemia, right? Hypomagnesemia. This card, I just want to know that it's ipsilateral. Slower, more twisting and writhing than chorea, resembling worm or snake. Aphthoid. We see this in cerebral palsy, basal ganglia disease, athetoid. I would have gotten it. Pyramidal versus extrapyramidal. So we're looking here at the extrapyramidal system. So the primary motor cortex, this is our basal ganglia is the important part here. Thalamus is there too. Also has input from the cerebellum and vestibular. If I'm being honest, I don't know what the vestibular system is. I know the vestibulocochlear nerve. I don't know what the vestibular system is. Oh yeah, it's like our cochlea. It's our position. Okay. So vestibulocochlear. I was in the ballpark there. Sure. There yeah. Schwarzschild. All right, blank sign. Include the brachial artery for 3 minutes. This is Trousseau's sign. This is our Italian, right? So Trousseau. So he gets his, the hand kind of curls up like this. I think this is also for hypocalcemia. Let me just look that up real quick. Yeah, I think those are forms of tetany. Hypocalcemia, I think, is the big one. Which is from hypoparathyroidism, hypomagnesemia, and then the hyperventilation we kind of talked about with respiratory alkalosis. Are we even recording? Yes. Okay. Active movement in the absence of gravity, and 3 is active movement just against gravity. Yeah. So 2 and 3 is gravity and no gravity. So 0 is no contraction. 2 is just a little bit of contraction. Not even a little, barely detectable. You just see a little something. That's a 1, right? 2 is active movement if you're in space, and 3 is active movement on Earth against gravity. Okay, so 2 in space, and we are the 3rd rock from the sun. So if it's active movement against gravity, you're on Earth, and that's a 3. Jumping, kicking, grooming behaviors, echopraxia are known as blank ticks. This is, it's something like, complex, right? These are complex things. So complex ticks, Tourette syndrome. Blanks test, tap on facial nerves, Schwarzschild. There we go. That's the 3rd time I've seen this already. Lower motor neuron is going to be reduced tone, reduced reflexes, and this whole thing is blocked. I don't know what it says. Wasting and fasciculations. All right, I'm going to take that. Control voluntary skilled movements travel through the corticospinal tract. Occlude brachial artery for 3 minutes at BP cuff leads to blank pedal spasm. Is it dorso? Carpopedal spasm. I'm going to take that. The elderly, levodopa, Parkinson's can cause tongue protrusion, eye blinking, grimacing. What is this? Is it dystonia? Oral facial dyskinesia. Okay. Rhythmic, repetitive, bizarre movements of the mouth and lips. Oral facial dyskinesia. And what is dyskinesia in general? Just like abnormal movements? Yeah, just uncontrollable shakes, tics, or tremors. We're going to see this in the mouth and in the face, this dyskinesia. All right, we have officially seen every card at least once, many of these twice. So now we're going to go through these hopefully a 3rd time and send them to tomorrow. Active movement against full resistance without fatigue, and that's a muscle strength score of 5. So now we can hopefully pick up speed. Which tremor seen in a hertz of 4 to 12 can be improved with alcohol and appears when muscles are involved. This is an essential tremor. Essentially, your muscles are involved, but no increase in muscle tone, and improves just drink, essentially, apparently, essentially, drink some alcohol. You'll be fine, right? Make that recommendation, write that script. All right, LMN disease like ALS, spinal nerve injuries, Guillain-Barré can cause muscle wasting or atrophy. Motor exam muscle strength, active movement against gravity, and 4 is some resistance, like I'm pushing on your hand. 5 is active movement against full resistance, and without fatigue. Yeah, I'm gonna see that again. Voluntary painless spasm that can be caused by hypoparathyroidism, calcium deprivation. Is this just chorea? Oh, it's tetany. I knew that. Most neurons in the corticospinal tract and the cerebral cortex crossover in the medulla, except for the proximal muscles. Anterior corticospinal tract do not cross over at the medulla, cross over at the level of the spinal cord. That's the big thing, though, is that it's the anterior one that keeps going. How do you test muscle tone, passive range of motion? Upper motor neuron, increased motor tone, increased reflexes. Strength, 0 is no contraction, 1 is barely detectable. So remember, 0 is the lowest you can get to. All right, a blank tremor, this is at 5 hertz, also known as a cerebellar tremor. Tremor intensity increases as I approach the object. Oh, but what is this called? Oh, intention. This is an intention tremor. Yep, good. What hertz is a physiological tremor, transient and not out of range of normal? Oh, we just looked at this. ETO, alcohol, essentially, is a 4 to 12. Oh, it's 8. Oh, it occurs with alcohol. Physiologically, you're able to play pool. Okay. Pyramidal versus extrapyramidal. Primary motor cortex is corticospinal tract and corticobulbar tract, which carries the cranial nerves. So these are lower motor neurons, controls voluntary. Okay. That's the pyramidal system. Cogwheel rigidity and lead pipe, which is that throughout the whole range, can be seen in this is it's Parkinson's. Yeah. Okay. How do you calculate the hertz of tremors? Oscillations in 10 seconds divided by 6. Upper motor neuron disease, actually blank in muscle resistance. You get an increase. Lead pipe cogwheel. So Parkinson's is an upper motor neuron disease. I mean, it's in your basal ganglia. So I guess, is that even what an upper motor neuron is? Like on a very fundamental level, what is that? We'll get to it. Lower motor neuron lesions seen with polio, Guillain-Barré, ALS cause a blank in muscle tone, a decrease. Duchenne muscular dystrophy causes this type of muscle bulk. Pseudo hypertrophy, which is like it looks bigger but without increased tone. Is that correct? It's like rubbery. Weakness, impaired strength. This is paresis. Rapid purposeless, jerky, asynchronous movements involving various parts of the body. Is this Korea? Yep. Yeah. Primary motor cortex is located in the blank lobe at Brodmann area 4. Frontal, caudate nucleus putamen, global pallidus, parts of the basal ganglia. Hopefully they give us some like softball questions like that. This is going to be paraplegia. All right, 4. All right, 5. Active movement against full resistance without fatigue. It's lifting weights for a few times, I guess, without getting fatigued. 4. Active movement against gravity and some resistance. This is me pushing on you a little bit. That's a 4. It's like pushing on you with 4 fingers, right? Some resistance. All resistance would be 5 full weight, but some resistance is just 4 fingers. That is a muscle strength of 4 if I can push against 4 fingers. Done. Huntington's disease and Sydenham's dystonia causes rapid. Wait, no. Sleep. Korea, not dystonia. Korea. Elderly can cause. This is oral facial dyskinesia, tongue protrusion, eye blinking, grimacing. Yes. What hurts is a physiological tremor. 8. Let me go back real quick. Fatigue, cold, so shivers. You shiver at 8 hertz. Bilateral shoulder and proximal arm tremor. This is wing beating. Involuntary painless spasm that can be caused by hypoparathyroidism. Oh, this is tetany. Of the motor system of the brain, abnormalities of the extrapyramidal system cause involuntary movements, like with Huntington's. Blank hypertrophy, increased muscle mass, but this diminished. Oh, so it's increased mass, but diminished strength. Not even the absence of increased strength, it's diminished. This is pseudo hypertrophy seen with Duchenne's. Writer's cramp, torticollis, involuntary contractions, bizarre postures are examples of this. This is the involuntary contraction and spasm of axial muscles. Is this dystonia? Paralysis, absence of strength. This is paraplegia. Cortico blank tract cranialis bulbar. A pill rolling tremor at 4 hertz. This is Parkinsonian. Of the motor systems of the brain, the pyramidal system controls voluntary movements. A motor exam grade of 0 means no muscle contraction. Okay, so again, this is with those myopathic weaknesses. You'll see proximal weakness over distal. This is that strong ankle, weak hip. So you'll have proximal weakness over distal weaknesses. When you have neuropathic weakness, its distal weakness is greater than proximal weakness. So you have like a strong shoulder, but you can't lift up your distal parts. You can't lift up your hands. Excessive glucocorticoids like Cushing's can actually cause the atrophy of muscles. Slower, more twisting and writhing than chorea. This is our athetoid, whatever. I'm saying it wrong, but I'll get it. See, now I'm stuck on this asp thing. But athetoid. It's almost like a mint, like an Altoid. Schwastek's test, tap on. This is leads to ipsilateral contraction of the facial muscle, rather than contralateral. 2, okay, active movement. This is 2 and 3. So 3 is earth. So active movement against gravity. 2 is active movement without gravity. Fasciculations. These are, so I completed without even reading the card. Visible, fine, fast, involuntary, spontaneous muscle contraction. I think it's like when your tongue, like literally the sides are like waving. Contraction of skeletal muscle fibers, benign. It could be ALS, hypomagnesemia. Jumping, kicking, grooming, echopraxia are known as blank tics and can be seen in Tourette syndrome. Oh, complex tics. Trousseau sign, cord brachial artery for 3 minutes with a BP cuff. Carpopedal spasm, that's Trousseau's. Schwastek's test. Extrapyramidal system, this is where basal ganglia is. Also has input from the cerebellum and the vestibular systems. Which tremor seen at hertz of 4 to 12 can be proved that alcohol and appears when muscles are involved if the patient has no increased muscle tone. It's not physiologic. That's 8. Is it essential? It's essential. Okay. And improved with alcohol. Blank tremor, 5 hertz, also known as cerebellar tremor. Tremor intensity increases as an intention tremor. It increases as I reach intention. Good. Pyramidal system, corticospinal, corticobulbar. Trousseau sign, occlude brachial artery for 3 minutes, leads to blank pedal spasm, thumb adduction, MCP joint flexion, carpopedal spasm. All right, 0 again is no muscle contraction. 1 is barely noticeable contraction. Involuntary painless spasm caused by hypoparathyroid. This is tetany. What hurts is a physiological tremor. 8. How do you calculate the hertz of tremors? 10 seconds divided by 6. Elderly, levodopa can cause which involuntary movement? This is oral facial dyskinesia. Rapid, purposeless, jerky, asynchronous movements involving various parts of the body. Hey, bud. This is Korea. It is. Weakness, impaired strength. This is paresis. And 4 and 5, active movement against gravity. 4 and some resistance. 5 is active movement against full resistance without fatigue. Okay, that's it. So I wonder if does this time? How long I've been going at this for? All right, so I'm done for now. I'm going to take a break. So I did 181 cards. All right, so I was studying for, looks like about an hour. So I went through, not really 181 cards. I saw that many like non-unique cards, but I did everything I needed to for neuro basics and for motor exam. It's like there's one, I have to do one more here. We have blank vertebrae, 33, 7, 12, 5, 5, 4. Good. But that's it. There's other stuff in this motor one that I have to look at, but like other than that, I don't have to read through these slides. I don't have to understand every single word and part of all these slides. I have most of it down. What I miss in these individual sessions, I will pick up in group study. That's the big other half of how I study here, is that what I don't think is important, what I overlooked, I trust on my study group and the other students around me to pick up on, and that's been working for over a semester. So I'm just going to continue that. So what I just did for these two, I just need to repeat for the other 6, add in some group study, spend some more time at those other slides that I kind of bypassed. I should be fine. This is actually really fun. I think I'm going to do this some more. But that's it for now. So I'm going to take a break. Maybe we'll do some more if I have energy.